Hey everyone, hopefully you're having a good week thus far. Apologize for the slight delay on getting this video up for you. We had a few students that hadn't taken the quiz, so I wanted to wait to to give quiz information until I had everyone's status established. So in week 2, we talked a bit about strategic planning, different steps in that process, and then also looked a little bit at law and ethics and corporate compliance, regulatory compliance. All important areas. I think you'll find as you go forward, and assuming you're in the HSA program, as you go forward, you'll have the opportunity to dig into these areas in much more depth. But hopefully this gave you a good idea of kind of where things are at. If you're in this class because you are doing the minor in health administration, you will have the opportunity to choose some of the different really focused classes, and so hopefully you'll kind of find something that piques your interest. The law and ethics side tends to be an area that a lot of people are interested in, but so hopefully you'll find something like that, and that will help you to choose the electives that you'll take for the HSA minor. So we had obviously our work for the week, group case studies, which I'm looking forward to digging into here shortly. If you did not complete your self and peer assessment, please do ASAP. That is required for grading for your group. So if you haven't done any, or if you haven't completed that, you're holding yourself up from getting a grade, but also your group members. So make sure that you get that in as soon as possible. So in week 3, we're looking at a couple different things. We're looking at marketing is kind of the overriding thing here in the week 3 discussion, but we're also looking at the patient as a consumer and that patient-centered care focus. So, for example, I recently, well, not recently now, a little over a year ago, moved down here to Orlando, and the insurance that we have has a very high deductible. So it's a high deductible health plan. It's $3,500, I think. So coming down here, I'm really trying to focus on finding providers that are reasonable in price and also high quality. So for example, I need to have an MRI done shortly. So instead of just going blindly to wherever wherever I was told to go by my provider, I actually had done some calling around to find out what the price would be, so I would have an idea of how much I was going to have to pay, because I won't receive any payment from insurance on that. It would just be going to deductible. So the ability to gain that information really makes the patient a consumer of healthcare instead of just a patient, where you just do everything the doctor says. The other side of that is we've really kind of reshaped healthcare overall by having more of a patient and family focus. So instead of just going to the doctor and the doctor telling you what to do, there's a care team, and there's other members, nurse case managers, and other members of the care team that really provide a patient-centric type of care. So it's a little different than what we've seen in the past, and that also provides value to the patient. So maybe if I go to one provider and there doesn't seem to be any support in that area, it's just a situation where you go to the provider, you see them, and you leave, and then you come back in 6 months. I might not go to that provider if the other one down the street charges a little bit more, but also has more of that patient and family focus, that they'll bring you in to discuss your prognosis and to discuss treatment options instead of just telling you what they are. They'll discuss them and really provide you with some value in that area. So there's a couple pieces within the classroom this week that hopefully can help to explain that patient-centered care, patient-centered focus. You'll also see providers that have reached a certification for a patient-centered medical home, and that's really that same thing, that very focused care team situation throughout the entire process of receiving care. So hopefully that makes sense. But we are also talking about marketing this week, as I said. So in our discussion this week, we'll be in that traditional written discussion board, But I'm looking for everyone to grab a piece of healthcare marketing. Don't just share a website. I've had students in the past say, here's a website. Try to get a piece of marketing, so like an advertisement, social media marketing, billboards, magazines, television ads, all kinds of things that are related to that. One that's easy in our area or in your area, not mine anymore, but in your area, if you're in the Pittsburgh area, are billboard marketing and also television commercials. They, constantly, UPMC and Allegheny Health Network are just constantly broadcasting commercials in that area. But you can choose anything. But share the piece in the discussion board if you can, a link to it or a picture of it or whatever it needs to be, and then talk about the questions that are noted here: decision making, ethical concerns, effectiveness, etc. And then look at your colleagues in class, some of theirs, and comment on your answers to those questions for theirs. So hopefully can be a good discussion there. We also obviously have a paper this week, a reflection paper on patient-centered care, and how that can help to improve quality in the healthcare system. So lots of work to do this week. Unfortunately, it is a busy week, but we also are in week 3 of an 8-week class. So it's condensed a lot more information to consume in an 8-week class versus a 15-week class if you haven't taken the 8-week classes in the past. So they are a bit more condensed. And then we have our quiz, and we have this Ed puzzle, which is going to be populating that space soon. So let's talk about quickly the quiz from last week. Obviously we're in week 3 now, but this was the week 2 quiz. So the first question: which of the following is not a potential barrier to successful execution of a strategic plan? So our answer is A, not enough strategies to implement. So that's not really a barrier. Lack of focus on the strategies can be a barrier. Strategies that don't align with the organization's culture is definitely a barrier. But you don't have to have a multitude of strategies to implement. So for example, you can create a strategic plan just around a single thing. So let's say you put get your strategic plan in place for a new unit, maybe a women's health unit or a wellness unit that you want to develop in your facility. There don't have to be 45 strategies to implement. It can really be focused around 1 or 2. So having multiple strategies to implement is not a barrier. Even if you had 1, you're in good shape there. So if you're doing a strategic plan over, say 5 years or 10 years, yeah, there probably will be several strategies, but by keeping it simple and not having a multitude, you're more likely to be successful. So having not enough strategies is certainly not a barrier there. Next question: information on an organization's core capabilities is relatively easy to obtain. So again, this goes to our work in strategic planning. And we want to make sure that we understand what the core capabilities of the organization are. The answer here is false, because it is not relatively easy to obtain. The core capabilities of an organization tends to be fairly subjective. So, if they simply are saying, the leaders think this about the core capabilities of the organization, that's really a subjective thing. Or maybe you take some surveys from patients or surveys from staff that are around what the organization's core capability really is. But again, it's just subjective. It's not financial numbers and those types of things that are very quantitative. We're looking at very much a qualitative look at the organization and determining what the capabilities are. Now, one thing that I will say is that oftentimes because of the subjective nature of this and who we need to get this info from, oftentimes it's skewed, it's biased based on their view. So for example, let's say that you're a hospital administrator and you're very involved in the cancer center there at your facility. So you would probably fill out on a survey that the cancer center is the best. That is a core capability of the organization, and our cancer center is the best in town. But then when you start to look at numbers and comparing yourself to, say, the competitor down the street, maybe you're not the best in town, but the bias that administrator is bringing to that discussion is going to be, it's just there. You're not going to be able to avoid that. Of course, we think our things that we do, activities, units, whatever it is, education, whatever it is that we're putting out, we're always going to think we are the best. And if we don't think that, that's problematic, and we need to do some quality assurance or quality improvement to fix those things. So, in other words, information that is on the core capabilities is certainly not easy to obtain because of the subjective nature of that piece and the bias that some of the people we need to ask bring to that discussion. Okay, last one. What is the role of the manager in the strategic planning process? So the manager is obviously very involved. When we're not talking C-suite leadership or the head of planning, we're talking more about the managers in the unit. So think of yourself as maybe the director of the radiology department. So what are the things that you're going to do? You're going to monitor their expertise or your expertise in terms of market developments. So you're going to know much more about what's happening in radiology nationwide more than, say, the director of planning or the CEO would know, because they're not involved in radiology. So it's really, the role of the manager to be marketing that stuff, or to be monitoring that stuff. There also needs to be input to the planning folks and the senior management on an ongoing basis of what this manager is seeing as far as setting goals, reaching goals, whatnot in their area. To monitor and control targeted strategies, absolutely. Let's say the strategy is to improve patient flow in the radiology department, so that would certainly be the role of the manager to manage that over time, and then to communicate strategies and rationales to staff. So all four of those are correct. So our answer in this case was E, all of these are correct. But just remember that sometimes we see planning on such a higher level, and if you haven't worked in an organization where you are dealing with that, it may not be as clear. But strategy tends to be developed in the C-suite, but implemented outside of the C-suite, and that's why we need to get those managers, those folks from the kind of a grassroots effort in the development of a strategic plan, so that the strategy can make sense and can be something that you would actually be able to implement. Okay, so that's all I've got. If you have any questions, always feel free to call, text, send me a note. I'm happy to set up time to discuss something or whatever works best for you. And other than that, I will see you in the classroom this week. You'll be seeing grades on your week 2 stuff here shortly, and I hope everyone has a good week. Thanks so much.